Dr. Kristie Ennis. Today we are going to go over knee pain relief exercises that you can do right in bed. I've had a lot of people recently tell me that they have a very difficult time getting onto the floor, so now you don't have to. How awesome is that? Someone's telling you not to get out of bed. That doesn't happen very often for sure. So the way this works is we want to get some blood flow and a little mobility going first, because a lot of times after sleeping, that's when the knee feels stiff and yucky, okay? So we're going to go over a group of exercises to work on that, and then we will get into a couple strengthening, or a few really, strengthening exercises, and then we're going to end with stretching. You want the stretching after, because you do have that blood flow going. The muscles are moving and things are warmed up, so stretching, static stretching, is more effective. So let's get started. I am going to take my handy dandy Derma Edge, and we're going to try to just get, like I said, some blood flow going through these muscles that surround the knee. So that would be the calf, the quad, the hamstring. I'll just bend up a little bit. This is actually something I created, I put together in my basement, and my husband and I actually have his and hers on our nightstand because we use them before bed, sometimes right after. If you do not, again, you can order this. I'll make sure to link that. You can use like a little rolling pin too. It's just not as comfortable, that's all. So you do that until you go, okay, well, maybe your skin's getting a little bit redder, or if you have PJ pants on, you go, oh, it's not as bumpy, right? Okay, that doesn't feel so bad. Or you're like, okay, it just feels better. Okay, so any one of those situations. From there, we're going to take, this is called the patella or the kneecap, and we're just going to work on getting on either side of it, and we're going to see, is it not moving very well in any direction? Mine's not moving well that way. You can see because it's not moving. So really, you're going to concentrate on trying to just press that over. Again, no pain, please, okay? All of this stuff is supposed to be comfortable, not uncomfortable. So you may even need to go in a couple different directions, and there is nothing wrong with that whatsoever. Moving down right to the tendon that attaches the quad muscle, comes right over that kneecap. This tends to get yucky too. We never want to be yucky. Yucky's bad, right? So we're going to do what's called cross-friction massage, taking two fingers right into the tendon, and you're just going back and forth. Now you're pressing pretty firmly here, and this can be uncomfortable. Don't kill yourself as you're doing this, but it can take a good 30 or 60 seconds before you go, ooh, well, that's not so bad anymore, okay? Once you go through those, I'm going to lie on down. And then you're going to do what we call a heel slide. It's literally just taking that heel, keeping it on the bed, and sliding it up. Now that there's a little blood flow going, it should be a little bit easier to actually get that knee flexion, that knee bend going a little bit better, all right? I'll sit back up again. From here, we're going to move into some strengthening, right? Don't you mess with the bull, young man. You'll get the horns. See what movie that's from. All right, so we're going to start with what we call a quad set. Literally just trying to flatten the knee down as you squeeze into this leg muscle. Squeeze. Sometimes I'll put something underneath the ankle too, and you'll get even a little bit straighter there. You can hold for a few seconds, but really think about squeezing here, pressing down. 10 to 15 reps on all of these if you can. All right, I'm going to lie back down again for the next one, but you're starting with that little quad set, squeeze, and I'm going to keep the other leg bent to help support the back, and then you're lifting. Now, you want to make sure that you don't let that quad go and have a bend, right? Squeeze that quad and lift. That's really important. And then to get all angles of those muscles, you're going to turn the leg out for about 10 repetitions, and then, again, as long as it's comfortable, you're going to turn that leg in. A lot of times people just go straight and they miss the rest of those quad muscles and up into the hip a little bit, okay? Coming from here, we're going to get the back of the leg. You're going to dig that heel in. So the knee comes up a little bit, and you're going to press that heel right down towards the bed. Hold again for another few seconds, right? Hold, relax. Try not to use your whole body to do this. Really focus in on here. If that's easy, then you can go ahead and move into a bridge, right? So my hands are going to come down. I'm going to squeeze my buns together, and I'm going to lift right up. Keep that rib cage down. Don't arch in either the low spine or up in here, where you're not really protecting your back anymore.
a little bit of an advancement there, and this is harder to do on a softer surface. You can certainly add a little bit of a march, keeping that pelvis level, or even a single leg bridge if it feels okay, right? That's just a little progression of those exercises. And then, even though we're talking about the knee, we need to make sure we get the rest of the hip, right? We got some butt, we got some hip in the front. Now you want to get the hip in the side. And this is like cozy nap position, right? So make sure that you are in one straight line. When I look down, I should see my toes and a little bit of my feet, but that is about it. You can keep the bottom leg straight, or you can bend the knee. And if this is too much pressure on the knee, you can put a pillow right in between there to help protect that. Now I'm going to aim for my heel as I come up. I'm going to turn my toes down a little bit so that I'm hopefully not using these hip flexor muscles and really concentrating on these side butt muscles, side hip muscles. Again, 10 to 15 reps. All right, and now that we're all worked out, we're going to stretch things a little bit. You can use a sheet, a strap, or even your hands. I'm going to use a strap because I just like the way this feels. So I'm going to put that underneath the ball of my foot. Try to extend that knee as much as I can. If this is all you got, don't go further than that, okay? And then just gently bring it towards you. Don't tilt your pelvis. That's where I see people go wrong. You can add a little bit of a foot motion too, back and forth. Sometimes feels really nice on there. And try to hold 30 seconds to a minute, or really until you feel it just kind of relax, and that maybe you could even pull in a little bit more. To add even a little bit more oomph to it, you can actually press right into the strap, or if you had your hands, you would press into your hands. Relax after holding for about 5 seconds, and then see if you can get a little bit more motion. Usually you can. So if you were doing it with your hands, same idea. I'd press right down into my hands and then see if I can get a little bit more motion. Last one is a quad stretch, and I am going to just show you the other leg. Yes, I know I was showing this one, but I don't want my butt facing you, so we're going to do it this way. All right, if you have the flexibility, you go ahead and just grab that ankle, but a lot of people don't, especially if your knee hurts. So key is you want to keep this knee actually bent and up front to help protect the back. And then if I want to use a strap, I can put that right around the ankle. It's getting stuck. And then gently pull back, right? So I can pull the hip back a little bit, and I can pull my heel up towards my butt. It's okay wherever you are. It doesn't have to be all the way here. And again, remember, keep that spine in mind. So there you have it. A nice, lovely routine that you can do without even getting out of bed. So thank you, guys.